Hi friends, today is World Heart Day. 29th of September every year is observed as the World Heart Day. It is observed to create awareness on various heart conditions that are affecting the population today, and also to emphasize on various measures to prevent and treat these heart conditions. The theme for this particular year is Use Heart for Every Heart, which focuses on how best can we use our heart for humanity, for the nature and for ourselves. Use heart means to think differently, make right decisions, help others, and to engage with this important cause so that the message can reach as many people as possible. Heart disease and stroke are the top two killer diseases in the world today. Roughly 18.6 million people die every year because of the heart diseases, and 50% of death due to all non-communicable diseases are because of heart disease and stroke. South Asians, which includes Indians, Pakistanis, Bangladeshis and Sri Lankans, are particularly vulnerable for heart diseases. Heart diseases occur at least a decade earlier in these group as compared to the Western population. Not only is it occurring earlier, the disease is more severe and also has a high case fatality rates. Many of the people who have heart disease do not have any particular sign or symptom. It is a sad thing to know that the first symptom of a heart disease in some individuals can be a heart attack or even a sudden cardiac death. We have seen many healthy and fit people suffering from a heart attack or even dying because of a heart attack. These are people who are apparently healthy, that is, they look healthy, but we do not know what was their blood sugar, what was their blood pressure like, how are their lipid levels, and what was the amount of stress that they had. So, a person cannot be considered fit just based on the appearance, but only after testing and declaring him to be fit. We can do some simple tests to know the condition of our heart. These are some physical tests like knowing what is your heart rate. The normal range of heart rate is between 60 to 100. The lower is your heart rate, the better is the condition of your heart, and you have a longer life. And the next thing is, what is your blood pressure? The normal blood pressure is 120 by 80 millimeters of mercury, and it is always better to keep our blood pressure below the level of 130 by 85 millimeters of mercury. And know what is your blood sugar or HbA1c levels. Know your lipid profile. In lipid profile, the triglyceride levels should be less than 150 milligram per dl. The LDL cholesterol or the bad cholesterol ideally should be less than 100 milligram per deciliter, and the HDL cholesterol or the good cholesterol should be more than 40 milligram per deciliter in men and more than 50 milligram per deciliter in women. Other tests like the serum uric acid levels, the thyroid hormones, the liver enzymes and the renal function test should ideally be at the lower range of normal. If you happen to get a ultrasound of the abdomen and it shows that there is fatty liver, that is a sign that you have insulin resistance, and it is only a matter of time that you will develop either diabetes, hypertension, heart disease because of this insulin resistance. We can do some tests that are specific to the heart, like a screening ECG and the echocardiogram can be done. In many people with ischemic heart disease, the ECG and echocardiogram are usually normal. Only 1/3 of the patients with ischemic heart disease have abnormal ECG. Other tests like the coronary artery calcium score, the test like the treadmill test or a myocardial perfusion scan can also be done, which can help us detect the underlying ischemic heart disease. In selected cases, a coronary angiogram can be done, which can be either an invasive angiogram or a CT based angiogram called the CT coronary angiogram, which can also be done. Poor diet is a major risk factor for all the chronic diseases. Cut down on the amount of the refined carbohydrates and the sugar that you intake. Sugar is addictive and is a major killer. Eat sufficient amount of protein, good quality fats, vegetables, fruits, nuts and seeds. Decrease your intake of oil. Avoid fried, packed and processed food. Avoid fruit juices and carbonated beverages. Try to eat food that is cooked at home as far as possible. Avoid smoking, as it is one of the most important risk factor for developing heart disease. Exercise regularly, at least 30 minutes a day. Stay active, sleep well, and focus on your stress levels. It is a good thing to know that at least 80% of premature death due to heart diseases are preventable, and almost all cases of asymptomatic ischemic heart disease can be managed with lifestyle measures and medical management. Ischemic heart disease is reversible, especially in the early stage where the amount of calcification and the degree of block is not very severe. So, let us all take a pledge that we will protect ourselves and also our dear ones from these heart diseases and say no to all those things that can damage our heart. Thank you.